doctor may have asked you to check your blood sugar. That's a great way to know what's happening. You can't always feel when your blood sugar is high. Usually you'll feel when it's low, but you can't feel when it's high. So it's a good idea to get in the habit of checking your blood sugar. I'm just pulling out a one-touch Vario, but your doctor may be ordering a different meter just based on what your insurance would cover. What's more important is that your insurance will cover the supplies. Most of the meters are all about the same. I will say this, a meter is not the same as getting a lab draw where they're taking a blood sample that way. This has got a 15% variance, which means you could check your blood sugar and it would say it's 120. 2 seconds later, I could check it again. It might say it's 135. That's in the reasonable range. So it's not as exact every single time as you think, but it gives you a really good idea what's happening with your blood. So a meter has different parts. The meter itself, some sort of Lancet device that's going to poke your finger. Strips to go into the meter where you put the blood supply. And then you need some sort of lancets to go in the device to prick your finger. So when you first use your meter, you're going to have to set up the time and the date. It might ask you some other questions. What language do you want it in? Once you set it up once, it should be okay until the time change happens. All right. So always wash your hands. Warm water and soap is the best. If you don't have that, then you're going to use an alcohol wipe. You don't want to use the antiseptic gels that we normally use for just keeping your hands clean in between things, because they have a film that can be left on there that may give you a false reading when you check your blood sugar. Soap and water or alcohol wipes. Those are the only two things you want to use. So I'm going to clean my finger off. When you're going to be checking your blood and taking a sample, we usually go sort of to the side, not on the pad. You have more nerve endings on the pad, so you can go over to the side. You don't want to use the same finger each time. You want to rotate it around. A Lancet device, they're all similar, have a little bit different. This one, I'm pulling the top off. This is the Lancet. The Lancet goes in. Hear the click. And then you're just going to be loosening up the top of the Lancet. And you can see the Lancet. And then you put the top of the device back on. All right, you're not going to just take the Lancet and poke your finger. You want it in a device. The device has a number for kind of how deep it goes. We always start kind of lower. 3 is a good place to start. All right. And then when it's time to test, you want to make sure the strip that you have matches the name of the meter, because you'll get, either it won't work or you'll get a wrong result if it's different strips. The strips have an expiration date, so you want to check every time you're using those that it's not expired. Expired strips would give you the wrong data. This strip goes in with the gold facing up. If you put it in wrong, it won't turn on. So you know you have it right when the screen comes on, and this one says apply blood and has a picture of a fingertip touching the strip. Some of the meters, the strips, the line goes this way. You'll be touching some. This one goes to the side. So you want to make sure that little line is like a straw. You want to line that up at your blood sample. All right. So when you're ready and your finger's clean, you could clean it at this point instead of holding your finger up the whole time. And then you can do it a couple different ways for testing your blood. I often stand up, but if you're not standing up, make sure you put it against the table. If you're holding it up in the air like that, there's a better chance that you might jump and not get a good stick the first time. So I stand up often to get the blood flow better. Once you have a drop of blood, that's when you squeeze it to get a bigger drop. If you squeeze it too soon, then you'll cut off the supply. Then you make sure the meter is still on. You bring the meter, you bring the strip, and you barely touch the drop, and it soaks it up. And then most of the meters will count down in 3 to 5 seconds and give you a result. So once you have a result, some of these you can mark them as before a meal or after a meal, or you could write it down on a log and what you ate and what timing it is. It's nice to give your doctor data. When you're going to bring the blood sugars to the doctor's trying to figure out, is your medicine working? Are your blood sugars in control? Do we need to change anything? So bringing the data will help them figure that out. So always bring your log and your meter and bring it to the appointments. And that's how you check your blood sugar.